This is Neil Osterweil. I'm talking with Dr. Andrew Norden about Watson for Oncology, the IBM supercomputer, if you will, or software platform, which has some very interesting data being presented here at the San Antonio Breast Cancer Conference regarding the use of this platform in helping doctors making their diagnoses. So, Dr. Norden, could you tell me a little bit more about exactly how this works, how Watson for Oncology is helping?
Sure. So Watson for Oncology is a cognitive computing system that is designed to provide clinical decision support to oncologists at the point of care. So how does it work? It can read a patient's medical record, and it can understand both the structured and unstructured data in that record. So that's critical because it's essentially able to read the doctor's notes. The so-called dark data, the areas of the record that previously were really inaccessible, can read all of that and ingest it, understand it, synthesize it into an abstracted set of attributes about a patient. And then understanding the patient like it does after it's done that work, it looks at several hundred textbooks, several hundred medical journal articles, professional guidelines, and also uses expert input from oncologists at Memorial Sloan Kettering Cancer Center. And considering all of that information makes treatment recommendations that are appropriate for the patient at the present time. So in other words, the output is a specific treatment regimen or set of regimens that should be considered by the doctor for that patient.
So would this platform be able to do things such as assists radiologists in reading films, doing cell counts, some of the things that can be automated in terms of pathology or radiology?
So the study that's being presented here in San Antonio is a study of an oncology clinical decision support system that functions the way I described. But Watson has a variety of different capabilities, all of which involve looking at large sets of data with multiple key attributes or multiple different types of data, and it can mine that data to create insights that are useful. And so the Watson for Oncology system is one that makes treatment recommendations to physicians, but there are other capabilities that Watson has that do allow it to look at images, for example, and that's a very important evolving field as well.
So you mentioned that this would work at the point of care. So how would it be used in the field? And what are the limitations? You have to have, obviously, I would imagine, internet access and some sort of equipment for, can telephones alone enough?
Right. So Watson for Oncology itself is a web-based platform, and so it can be accessed using any device that can access the web with a reliable internet connection. It is used by customers around the world today by physicians or their teams to make actual decisions on actual patients at the point of care. One of the key capabilities I spoke about is its ability to read and understand and draw insights from the medical record. Of course, if your system is on paper, that's a problem today for Watson, and so some manual data entry is needed in a situation like that. But to the extent that it's integrated with an electronic medical record, essentially all that's needed is internet access.